Types of diseases: cancer, AIDS, acquired immunodeficiency syndrome, typhoid. Cancer. Cancer is an abnormal growth of cells in an uncontrolled way and resulting into a harmful tumor. In some cases, it shows metastasis or spread. Cancerous cells show following characteristics: uncontrolled mitotic cell division or abnormal growth of cells, ability to invade adjacent tissues and distant organs, loss of cell differentiation. Cancer cells form tumors. Cancer interferes with body functions which result in death of the affected person. Tumors. Cancer forms an abnormal mass of cells called tumors or neoplasm, that is new growth. A tumor is an abnormal mass of tissue formed as a result of excessive, uncoordinated, autonomous and purposeless proliferation of cells. The branch of science dealing with the study of tumors is called oncology. Onkos meaning tumor, logos meaning study. Types of tumors. Benign tumors, mass of well-differentiated cells and enclosed in a fibrous connective tissue capsule. It has no capacity to spread to other areas of the body. For example, fibroadenoma of the breast and the uterus. Malignant tumors. It is a mass of undifferentiated cancerous cells and not enclosed in a capsule. It shows metastasis. For example, malignant carcinoma of the breast. Types of cancer. Carcinomas. Cancer of the epithelial tissue. Example, skin, breast, lung, bladder, cervix, pancreas, stomach, etc. Sarcoma. Developed from the mesoderm, connective tissue and cartilage. Example, bone cancer, osteosarcoma, cartilage cancer, chondrosarcoma. Lymphoma. Developed from lymph glands and spleen by abnormal increase in lymphocytes. Example, jaw cancer, that is Burkitt's lymphoma. Leukemia. Develops from the hematopoietic cells of the bone marrow, commonly called as blood cancer. Carcinogenic agents or cancer-causing agents. Agents which cause cancer are called carcinogens. Chemicals: coal tar, heavy metallic ions, polycyclic hydrocarbons, benzene, arsenic and chromium cause esophageal, skin and rectal cancer. Radiation. X-rays, UV rays, alpha rays, beta rays, gamma rays and radioactive isotopes cause skin cancer, leukemias and cancers of the thyroid, breasts, lungs, etc. Biological agents. Certain viruses, some parasites and bacteria can cause cancer in humans. The viruses capable of inducing tumor are called oncogenic viruses. Human papilomavirus (HPV) causes cancer of the cervix. Hereditary cancer, retinoblastoma, eye cancer. Addiction, smoking, lung cancer, alcohol, liver cancer, drugs, skin, lung, liver cancer, etc. Fatty food causes breast cancer and beef causes intestinal cancer. Pollution, pesticides, insecticides, excess intake of steroids cause cancer. Synthetic colors, salts like Ajinomoto are also capable of causing cancer. Symptoms of cancer. Unusual bleeding from natural openings. Change in the size and color of warts or mole of the skin. Sudden loss of weight. Indigestion, change in bowel and bladder habit. Persistent fever. Excess bleeding in menstrual cycle. Continuous white discharge in females. Persistent coughing, hoarseness, difficulty in swallowing. Unusual bleeding through wounds and non-healing wounds. Sores in mouth that fail to heal in time. Appearance of lump in the breast. Preventive measures. Avoid smoking, tobacco chewing, excess alcohol consumption. It reduces the chance of both lung and mouth cancer. Wash vegetables and fruits to remove insecticides. Implement Pollution Control Act. Ban on industries which release carcinogenic material in air and water. Regular checkup after the age of 30 years and testing of food. Avoid exposure to at least the known carcinogens like radiation, pesticides, etc. Treatment. Curable in early stages. Treatment depends on the type of cancer. Surgery of tumor. Surgical removal of the cancerous part. Radiation therapy. Destruction of tissues by gamma rays, X-rays, cobalt-60 and radium for cancer of skin, bladder and cervix. Chemotherapy. Cytotoxic anti-cancer drugs or specific chemicals are used to kill cancerous cells by damaging DNA or interfering DNA synthesis. Chemical or anti-cancer drugs are alkylating agents. Example, cyclophosphamide and miclorothamine. Antimetabolites, example, 6-mercaptopurine and 5-fluorouracil. Anti-tumor antibiotics, example, doxorubicin and mitomycin C. And plant alkaloids like vincristine and vinblastine prepared from Vinca rosea, Sadafuli plant. Immunotherapy, with the help of monoclonal antibodies, especially linked with radioisotopes. AIDS, acquired immunodeficiency syndrome. AIDS is caused by a retrovirus called human immunodeficiency virus, HIV. HIV is single-stranded. It belongs to the retrovirus group, lentivirus subgroup, that is a slow-acting virus of the family Retroviridae. AIDS is caused by retrovirus HIV. Normally, DNA converts into RNA, but in retrovirus, RNA converts into DNA with the help of an enzyme called reverse transcriptase. 1st December is observed as World AIDS Day. Structure of HIV. HIV is believed to have been transferred from an African monkey. HIV is an enveloped virus, 90 to 120 nanometer in diameter and highly fragile. It is spherical in shape with an outer coat of lipoprotein. It consists of two types of antigen, namely surface and core antigens. Surface antigen is formed by glycoproteins like GP-120 and GP-41. Nucleoprotein core antigen containing single-stranded RNA genome and proteins P17 and P24. In association with viral RNA is the reverse transcriptase enzyme, which is a characteristic feature of the retrovirus. When the virus infects a cell, the viral RNA is transcribed by the enzyme first into a single-stranded DNA and then to a double-stranded DNA, provirus, which is integrated into the host cell chromosome. The provirus can remain latent for a long period, though it influences host cell functions. The main target of HIV is CD4 cells or the helper T cells, which form the main line of defense in the body. It results in decrease of T helper cells, that is, CD4 cells, and decreases the acquired immune response, and such HIV-infected persons are susceptible to various opportunistic diseases like pneumonia, Kaposi's sarcoma, and tuberculosis. Source of infection. It is found in high concentration in semen, blood, and CSF of infected or carrier person. It is found in low concentration in vaginal secretion, saliva, and breast milk of the infected or carrier person. Mode of transmission. Intimate sexual contact with HIV-infected person, that is, an HIV-positive person. Through blood and blood products, common in drug addicts. Unsterilized surgical instruments, syringes, and needles. Sexual contact, body secretions. Sharing a razor and toothbrush of the infected person. Infected mother to her child through placenta and breastfeeding. Symptoms of AIDS. Carrier phase or non-specific. Mild viral infection for a week, prolonged fever, diarrhea, red rashes, etc. Specific symptoms. AIDS-related complex, ARC. Swollen lymph nodes, night sweating with itching, wasting syndrome. AIDS dementia complex, ADC, loss of memory and body coordination. Full-blown AIDS, end stage of the disease, complete collapse of the immune system. Victim of opportunistic infections, complete collapse of the immune system. Victim of opportunistic diseases like tuberculosis, pneumonia, Kaposi's sarcoma, lung infection by pneumomycosis carinii. Diagnosis of AIDS. ELISA test, enzyme-linked immunosorbent assay. Confirmatory test, Western blot test or immunoblot. Preventive measures. Educating the people specially of high-risk groups. Avoid sexual contact with multi-partners, prostitutes and homosexuals. Use condom before sexual contact. Do not share a razor, toothbrushes, syringes and needles. Screening of blood for HIV. HIV-positive female should not get conceived. Treatment of AIDS. There are no curative methods for AIDS. Many antiretroviral drugs suppress the HIV infection and prolong the life of the AIDS patient. Typhoid. Typhoid fever is an acute communicable disease caused by Salmonella typhi. The second most common serotype is Salmonella paratyphoid A, is responsible for 1.3 to 15% of the cases. Salmonella para B is relatively infrequent. Salmonella typhi has been classified into number of phage types, but the common ones in India are A, E and O. These bacilli are gram-negative rods of about 1 to 3 mu in length, rod-shaped, motile, and have petricous flagella. H antigen on flagella and O antigen are present on the body wall. Bacilli remain alive in feces and water for a considerable period, when not exposed to sunlight, but do not multiply in them. They multiply in milk. They are destroyed by heat at 60 degrees Celsius. They are killed in 2.5% phenyl. They may live for many weeks in ice. In the upper layer of soil, they retain their vitality for a long time. On autolysis, the organism liberates an endotoxin. Person who excretes the bacilli for more than 1 year after a clinical attack are called chronic carriers. He may excrete bacilli for several years. The famous case of Typhoid Mary, who gave rise to more than 1,300 cases. Immunization against typhoid does not give 100% protection. The peak period of typhoid is July, August and September. Mode of transmission: fecal-oral route, that is through contamination of water, milk, food, etc. Other routes are vector transmission through houseflies and unhygienic surroundings. Symptoms: systemic expression of high-grade fever, rose-red spots on abdomen, bronchitis, pneumonia and intestinal hemorrhage, headache, classic typhoid fever, malaise, diarrhea, etc. Preventive measures: cultivation of hygienic habits, disposal of excreta in a proper way, isolation of infected person. Treatment: use of antibiotics like chloramphenicol, ampicillin, chloromycin. Immunization for children: use of vaccine like TAB. Diagnosis: Vidal test.